Gaza City medics describe hospital overwhelmed by casualties from Israeli strikes. Doctors at one of Gaza City's last functioning hospitals say they are overwhelmed with casualties from Israeli strikes and are having to carry out operations in filthy conditions with few or no anesthetics. One Australian medic volunteering at Al-Shifa Hospital told the BBC that every day was a mass casualty event, while another described how a baby had been saved from the body of a pregnant woman who had been killed. Israeli forces are now just 500 meters 1,640 feet away from the hospital as they expand their ground offensive to fully occupy Gaza City, which Israel's military calls Hamas's main stronghold. Witnesses say tanks are advancing into the city center from the south and northwest. Israeli air and artillery strikes, attacks by quadcopter drones, and detonations of remotely driven vehicles laden with explosives continue to drive tens of thousands of Palestinians from their homes each day. The Israeli military says it is carrying out the offensive in Gaza City to defeat Hamas and secure the release of the hostages still held by the group after 23 months of war. Some of the Palestinians killed during the Israeli offensive in Gaza City are being buried in the grounds of Al-Shifa Hospital. Al-Shifa Hospital was once the biggest medical complex in the Gaza Strip. It now lies in ruins, pockmarked by craters with burned-out wards and bullet holes. But inside, medics are working beyond full stretch. Many of the beds do not even have mattresses. Medicines are in short supply and the casualties are endless. It's just a mass murder, a killing, a torture, a nightmare. Dr. Nada Abu Alrab, an emergency specialist from Australia volunteering at the hospital, told the BBC in a video call on Tuesday. She said they were operating on severely wounded patients with minimal to hardly no anesthesia, no painkillers as well, with their limbs hanging with a piece of skin and the tendon. Brain matter out. Organs are out. It's horrific, she added. Last week, she said, doctors had to conduct an emergency cesarean on a 9-month pregnant woman whose head had been blown off. They managed to save her daughter. The baby was a bit bradycardic, so her heart rate was low, she recalled. She was transferred to another hospital. Dr. Saja Aziz, an Australian anesthetist, described how a 6-year-old boy with a fractured arm and leg had been waiting for 3 days for an operation to place external fixators on them because the hospital's only orthopedic surgeon had to prioritize more serious cases every couple of hours. There are multiple amputation cases with massive resuscitation. It's life or limb, literally, she told the BBC. And you go in and you're trying to anesthetize them while they're swatting flies in theater. There's blood over the beds. There's no equipment. There's no replacements. And you can see the sorrow and the sadness of the healthcare work.